Good morning, everyone, and thank you for joining us. I'm Darla Castelli, and I am the co-chair of Whole Communities, Whole Health as a grand challenge at the University of Texas at Austin. I am a professor in the Department of Kinesiology and Health Education, which is located in the College of Education. And I'd like to thank you for being here with us today to discuss maximizing retention in longitudinal research projects. This is actually the second part of our series of professional developments. And the first part focused on recruitment of individuals from vulnerable populations. And now our second part focuses on the retention of those participants across an extended period of time. Our agenda for today actually is interactive, and I'm hoping that you engage in the discussion with us and you bring forward your ideas as well as those that we're going to hear from excellent presenters and lineup that we have assembled here today. So the first part is about hearing from our expert panel and then a roundtable discussion and then open exchange and discussion about our collective learnings together today. Well, in Texas, it's unique to live here. I'm actually from the Northeast, so I'm an honorary Texan. And as an honorary Texan, these are some of the observations that I have made. Texas ranks 43rd in overall child well-being. Texas ranks last when it comes to socioeconomic disparities in children's health. A fourth of the children live in poverty. But Texas is unique because it is a microcosm of the United States. And so its diversity and richness and resources are actually representative of the broader United States. And so this makes our ground very fertile for the notion of intervening and providing assistance, as well as learning from our community members. The prevalence of COVID really hit us hard, and it hit us hard not only from a global perspective, but the notion of the prevalence and regional differences right here in our own community. And we have scholars on our team who actually have looked at regions, different regions of this central Texas area, specifically east of I-35, specific zip codes, and how that there were disparities in the risk for severity of contracting COVID-19, receiving vaccinations, and also receiving assistance when needed. And so we have right within our own backyard need, which is within our own UT community, as well as the residential communities just outside that. So that was one example of what was important to us when we wrote the internal proposal for the Grand Challenge to become one of three Bridging Barriers initiative. Planet Texas is one of the other bridging barriers, and Good Systems is also a bridging barriers. So the VP Office for Research actually sponsors the infrastructure for us to have these high risk, high reward outreach types of projects that bring together in a collaborative manner a transdisciplinary, interdisciplinary team of scholars. So our mission was to better understand and address what matters most to communities who are facing health disparities, and to help families thrive in their environment. So if we collected the data, we could then use the data for purposes of advocacy. And by taking a community engaged approach, we were informed by the concerns of the community and then able to be light and responsive as those concerns emerged, and also gain access to resources that we could share with the broader community. Our research team actually has representation from 27 UT departments or affiliations, and that lends itself to both promise, outstanding promise, but also sometimes we're limited by our own science and our own jargon. And so it took a little bit of learning to completely understand the lens in which each one of us brought to this project, but super exciting. I'd like to also think of us from the perspective of there are multiple ways to look at health. And by having such an interdisciplinary team and by engaging the community, ultimately, it increases the probability that actually we can be very effective in our forms of intervention. We're coming to a better understanding of the community. And I wanted to highlight on the screen not only the different elements of health, but also on the bottom, these are all pictures from our community engagement, which as we are entering in our third year, we spent an entire 2 years in the process of development and building relationships with a little bit over 50 different community partners. And so you can see on the bottom screen, there was a tabling event where we are engaging the community by being part of wellness presentations, being part of family fitness evenings at schools. Then we engaged the Central Texas Food Bank, and we did a day in the community, and the day in the community, we learned about the services that they provide and the resources available. We also distributed here soccer ball, seeds, and care packages during COVID. We created a Protect Texas Together application that was used on the broader campus community to identify our risk and mitigate that risk for COVID. And we have also engaged the School of Nursing and their Children's Wellness Center, as well as we've had events where we engage these are future physicians here who are DelMed students, and they distributed free helmets to children on one of our community events. So the broader perspective brings more resources to us and the notion of this interactivity and engagement, again, across those 27 different units on campus. I would like to think of not only this project as interdisciplinary, but pushing the envelope towards transdisciplinary. And what do I mean by this? Well, when two scholars who are in different departments or different units get together and ask the question about children's health, we might say, how do physical activity and sleep affect physical health? So David Schneier and I get together, we ask the questions, our two labs collaborate, and we answer that question. To me, that's interdisciplinary in nature. But as we start to push the envelope a little bit more to this notion of cross-disciplinary, we start to cluster together even more factors that may impact the lives of children and their families who support them. So we might think about ambient temperature and particulate matter. We might think about the effects of stress on physical health. And so now our collaboration deepens because each individual brings their expertise to the table. But not only that, we're starting to share resources and methodological techniques to get to the point where our thinking is actually the creation of a new model or a new way of doing business, with the community at the center and the community engaged to the degree where they're providing feedback and co-planning our research and co-planning our community events and how we redistribute resources and access resources in that manner. So I like to think of us as getting to the point, or at least I like to pose the challenge that we get to the point that we are transdisciplinary in nature and create this new model and a different way of doing business. The bottom line is, it's been a challenging 14 months. It's been a challenging 14 months for everyone, I'm sure. I'm very confident of that. And so it was difficult. We had to be very creative with the families that we have already established relationships with, and how we were going to continue to nurture those relationships through Zoom meetings and distance. And one of the things that we're currently working on here on the left is a community-facing dashboard and phone application that, in essence, data that are collected from your home in relatively close to real time, but not exactly real time, that those data are actually dropped into your phone, and you can have some specific feedback about your daily habits or your living and the behaviors that you engage in, your environment, and understanding each one of those things. So these icons here represent a beta testing version of the types of information that we'd like to loop back to our community as they provide it to us as on the UT campus, and then we loop it back to them so that they're for their own edification and for their own use for advocacy purposes. In attempting to retain and nurture the relationships with families that we already had a connection with, ultimately we got super creative. And we asked children and their families to show us how they could be physically active and they could enhance their own health when they were at home in social isolation. And these were some videos that we collected through a small pilot project called the SMART Project. And the SMART Project is an online cooperative game that students and children engage in physical activity, and then it propels them across the United States, and they learn STEM content along the way. So Chris